Sleep. We spend roughly 1/3 of our lives doing it. Yet, many candidates find sleep neurobiology confusing. REM sleep, NREM sleep, sleep spindles, neurotransmitters, dreaming, muscle paralysis. How do all these things fit together? In this video, I will simplify sleep stages and the neurobiology behind them so you can confidently answer paper A questions related to sleep and its neurobiology. So let's begin. Let's understand why sleep matters. Sleep isn't simply switching off. The sleeping brain is highly active as well. Sleep is essential for learning, memory consolidation, emotional regulation, physical recovery, and cognitive performance. Disturbances in sleep are associated with many psychiatric disorders, including depression, bipolar disorder, anxiety disorders, schizophrenia. So let's understand the two types of sleep. There are only two major categories, NREM sleep and REM sleep, or the REM sleep. To remember this, simply remember, think of NREM with physical restoration and REM sleep with brain activity and dreaming. Let's understand these stages in detail, beginning with NREM sleep. Now, NREM sleep accounts for approximately 75 to 80% of total sleep, and it is divided into three stages. Stage N1, N2, and N3. Stage N1 is the light sleep. The transition from wakefulness to sleep. So the period where we are falling into sleep, that is stage N1. It is characterized by slow eye movements, reduced awareness, muscle relaxation, and hypnic jerks. And most people spend very little time in this stage. They quickly move on to stage N2, which is the most common sleep stage. It is characterized by the presence of sleep spindles and K complexes. Remember these two terms as they are extremely important for paper A. Sleep spindles are thought to play a role in memory consolidation as well. Exam tip: see sleep spindles and think of stage N2 immediately. Stage N3 is also called slow wave sleep or deep sleep. This is the most restorative stage, and it functions to help with the tissue repair, to help with the immune function, the growth hormone release, and the physical recovery. This stage is associated with sleepwalking, night terrors, and confusional arousals. And these are the classical exam questions that you need to remember for paper A. Let's move on to REM sleep. REM stands for rapid eye movement. This stage looks paradoxical. The brain is highly active, yet the body is effectively paralyzed. It is characterized by the features like rapid eye movements, vivid dreaming, increased cerebral activity, muscle atonia, and memory processing. And this is where most of the dreaming occurs. Now, have you ever wondered why muscle paralysis occurs in this stage? To understand this better, just imagine acting out every dream. It would be dangerous, isn't it? The brain prevents this by switching off most of the skeletal muscle activity, and this phenomenon is called REM atonia. Let's understand the sleep cycles a bit. Sleep follows a very predictable pattern mostly. Throughout the night, we move through N1, N2, N3, REM, and each cycle lasts approximately 90 minutes. As the night progresses, REM sleep periods become longer and deep sleep becomes shorter. Let's understand the neurobiology of sleep now. So let's discuss the neurotransmitters, and this is where many paper A questions originate. Now, some of the neurotransmitters which are important when we talk about sleep neurobiology are GABA, that is gamma aminobutyric acid, serotonin, melatonin, acetylcholine, norepinephrine, dopamine, and orexin. Now, GABA, as we know, is the major inhibitory neurotransmitter. It promotes sleep by reducing the neuronal activity. It decreases arousal and neural excitability. So when you think about GABA, think about going to sleep. Many sleep medications enhance GABA activity, like diazepam, temazepam, zopiclone, and the list goes on. So it's associated with NREM, especially N2 and N3 stages. But GABA activity is there for all the stages of the sleep as it is sleep promoting neurotransmitter. Now, serotonin. Serotonin helps to regulate sleep onset. It contributes to sleep initiation, sleep stability, and circadian rhythm regulation. Interestingly, reduced serotonin is associated with insomnia and depression. So remember, serotonin is helpful in sleep initiation and it promotes sleep. Next is melatonin. Melatonin, as we know, is produced by the pineal gland and it helps to regulate the sleep-wake cycles. Darkness stimulates melatonin release and light suppresses melatonin release. And this explains why screen exposure before bedtime can disrupt your sleep. So melatonin is again important for promoting sleep and synchronization of sleep-wake cycle. Acetylcholine becomes highly active during REM sleep. High acetylcholine activity contributes to dreaming, cortical activation, memory processing, and REM sleep is characteristically associated with increased cholinergic activity. When we talk about noradrenaline, remember noradrenaline promotes wakefulness. So the levels usually decrease when we sleep. They become particularly low during the REM sleep. And this allows the dreaming to occur during REM sleep. So it is high in wakefulness and low in NREM sleep. It is absent in REM sleep. And that's why dreaming occurs. Now, when we talk about dopamine, dopamine is another neurotransmitter which promotes wakefulness. That means it suppresses the REM sleep. So again, it will be high in wakefulness and low in REM sleep. Orexin is also called as hypocretin. It helps to maintain the wakefulness. So when there is deficiency of orexin, that causes narcolepsy. Remember, it is a very common paper A question. Narcolepsy is associated with low orexin levels. Let's understand the connection between sleep neurobiology and psychiatric disorders. Now, when we talk about major depressive disorder, depression is associated with reduced slow wave sleep, shortened REM latency, increased REM density, early morning awakening, and poor sleep efficiency. Patients with depression often enter REM sleep earlier than other people. Bipolar disorder, here sleep disturbance often precedes the manic episodes. So in mania, it is characterized by a reduced need for sleep and reduced total sleep time. There is reduced slow wave sleep, increased REM sleep, and irregular sleep-wake rhythm. Schizophrenia is characterized by a disrupted sleep architecture, wherein patients may show reduced sleep efficiency, abnormal REM patterns, and circadian rhythm disturbances. Anxiety disorders are again characterized by difficulty in falling asleep, frequent awakenings, increased stage N1 and N2 sleep, and reduced slow wave sleep. So consequently, patients will complain of daytime fatigue. Post-traumatic stress disorder. What happens? The typical sleep changes would be difficulty in falling as well as staying asleep. So there will be nightmares. Nightmares are characteristically seen in PTSD. So that means there is an increased REM intensity. It is the REM phase where dreaming occurs. So for nightmares to happen, there should be an increased REM intensity and increased REM density. So that is something which characterizes the sleep architecture in post-traumatic stress disorder. Now let's look at some of the classical paper A questions. Question number 1. Sleep spindles are found in which stage? Quick, on the tip of the tongue, it should be N2 stage. Night terrors occur during which stage? Answer is N3. Dreaming occurs primarily during which stage? Answer is REM sleep. Which neurotransmitter deficiency causes narcolepsy, orexin, or hypocretin? Now, let's look at some of the memory hacks which will help you to answer most of the paper A questions. Remember, stage N1 is falling asleep. Stage N2 characterized by sleep spindles and K complexes. Stage N3 is the deep sleep. REM sleep is the dreaming sleep. GABA promotes sleep. Acetylcholine high in REM sleep. Orexin associated with wakefulness, and deficiency is associated with narcolepsy. If you remember, N2 is sleep spindles, N3 deep sleep, REM, dreaming, orexin, narcolepsy. You will answer the majority of sleep neurobiology questions in MRCpsych Paper A. Thank you for watching, and don't forget to subscribe for more high-yield Paper A revision videos. See you in the next video.